The musculoskeletal system and related conditions. Muscles, bones, ligaments, tendons, and cartilage give the body shape and structure. They work together to support, move, and stabilize the body. The musculoskeletal system can weaken with age, increasing the risk of injuries and musculoskeletal diseases like osteoarthritis. Regular exercise throughout a person's life is crucial for keeping the musculoskeletal system healthy. Musculoskeletal disorders are a group of conditions that can affect the muscles, bones, joints, tendons, ligaments, cartilage, and spinal discs and may cause pain, loss of mobility, swelling, and stiffness. This educational program will discuss the function and anatomy of the musculoskeletal system, as well as a variety of conditions that can affect this system and ways to keep the musculoskeletal system healthy. The musculoskeletal system, also known as the human locomotor system, is the framework of the body. It is controlled by the nervous system and comprised of bones, muscles, joints, and many connective tissues that bind them together. Among its many important functions, the musculoskeletal system gives the body shape, supports the body, allows the body to move, shields vital organs from impact damage, stores essential minerals like calcium and phosphorus, which are crucial for bone and cell maintenance, produces red and white blood cells through the bone marrow, and operates breathing by muscle contractions. The musculoskeletal system is constantly regenerating through your life. Its health is profoundly influenced by physical activity. Living an active lifestyle not only enhances musculoskeletal functions, but also protects against musculoskeletal diseases. To understand how the musculoskeletal system works together, one needs to be familiar with its parts. Bones. There are 206 bones in the adult human body. Bones consist of a hard outer part called cortical bone with a softer inner portion called trabecular bone. While the structure of all bone is the same, the bones perform various functions in the body. Bones provide structural support for the body and form a protective armor around the organs. Bones store calcium and phosphorus, which are essential for bone, teeth, and cell health. They have an inner cavity that contains bone marrow, where red blood cells, white blood cells, and other components of blood are produced. Bones undergo a process that is known as remodeling. Bone remodeling is a continuous process whereby old bone is gradually replaced by new bone. About 25% of the trabecular bone and 3% of the cortical bone are removed and replaced through the remodeling process each year. Muscles. There are two kinds of muscle that are part of the muscular skeletal system: skeletal muscles and smooth muscles. Skeletal muscles are bundles of contractile fibers, meaning they move various parts of the body by contracting. They are attached to the bones and positioned in opposing groups around the joints. For example, muscles that bend the elbow are positioned opposite muscles that straighten the elbow. Skeletal muscles are controlled by the brain, operating voluntarily under a person's conscious direction. Smooth muscles are involved in certain bodily functions that are not under a person's control. They are located around some of the arteries and contract to adjust blood flow, and located in the intestines and contract to move food and feces along the digestive tract. Smooth muscles are controlled by the brain, but not voluntarily. The engagement of smooth muscle is based on bodily needs, not conscious control. There's more to muscles than keeping you strong. When you exercise, your skeletal muscles emit proteins called myokines that regulate body weight, reduce inflammation, increase insulin sensitivity, suppress tumor growth, and improve cognitive function. Cartilage. The ends of the bone that form a joint are covered with a connective tissue called cartilage. Normal cartilage is smooth, flexible, and tough. Cartilage serves to absorb shock during activities like running, jumping, and other forms of impact. It reduces friction with the movement of a joint, preventing bones from rubbing together. It also enhances the resilience of bones and protects them from wearing down. Cartilage lacks lymph nodes, blood vessels, and nervous tissue. While this makes cartilage resilient, the limited blood flow makes it less capable of repairing and renewing itself. Because of this, disorders due to the breakdown of cartilage like osteoarthritis can be severely painful and disabling. Joints. The joints are where the ends of two or more bones come together. While there are joints that do not move, such as the joints between the plates of the skull, most joints facilitate movement. There are two types of joints that facilitate movement: synovial joints and cartilaginous joints. Synovial joints are the most common joints in humans. They are able to slide without friction due to the slippery, lubricated cartilage that covers the ends of each bone at the joint. The elbow joint and the hip joint are examples of synovial joints. Cartilaginous joints are completely united by cartilage where the two bones meet. They are rigid joints and have limited movement. The pelvis is an example of a cartilaginous joint. They are able to withstand high impact activities like running and jumping due to the cushioning the cartilage provides. Ligaments. Ligaments are tough, fibrous bands of tissue that connect bone to bone. They are composed of collagen and elastic fibers, which give them a rubber band-like stretchability. Ligaments surround and support the joints, allowing movement in specific directions. They ensure the bones in a joint do not dislocate or twist too much. Ligaments are particularly vulnerable to damage caused by overuse, trauma, and disease. While they are capable of self-healing after an injury, the process tends to be slower compared to muscles and bones. Tendons. Tendons are similar to ligaments, except rather than connecting bone to bone, tendons connect muscle to bone. Tendons primarily perform the following functions. They absorb the forces that muscles generate upon impact, evenly transfer those forces to the bones, and protect muscles from injury. Bursae. Bursae are small, fluid-filled sacs that cushion the spaces between the bones, tendons, and muscles near joints. They are mostly found next to large joints, such as shoulders, elbows, hips, and knee joints. They minimize friction between these structures and help absorb shock upon impact. Exercise is important for improving and maintaining physical and mental health. Inactivity and immobility can result in a loss of self-esteem, depression, pneumonia, and urinary tract infections. They can also lead to constipation, blood clots, dulling of the senses, and muscular atrophy or contractures. When atrophy occurs, the muscle wastes away, decreases in size, and becomes weak. When contracture develops, the muscle or tendon shortens, becomes inflexible, and freezes in position. This causes permanent disability of the limb. Range of motion exercises can help prevent these conditions. With range of motion exercises, the joints are extended and flexed. Exercise increases circulation of blood, oxygen, and nutrients, and improves muscle tone. It is important to encourage movement when doing ADL with residents. The more they move, the better they will feel, and the better they will feel about themselves. CNAs should encourage residents to do as much for themselves as they are able to do. Normal changes of aging include muscles weakening and losing tone, body movement slows, bones lose density and become more brittle, which can make them more susceptible to breaks. Joints may stiffen and become painful, and height is gradually lost. Staying active can slow these processes. Musculoskeletal disorders are a group of conditions that can affect the muscles, bones, joints, tendons, ligaments, cartilage, and spinal discs. They can cause pain, loss of mobility, swelling, and stiffness. According to the World Health Organization, musculoskeletal disorders typically fall into 4 categories: joint conditions, bone conditions, muscle and tendon conditions, and other health conditions. Several musculoskeletal disorders can affect the joints, including gout, a type of inflammatory arthritis that can cause swelling, stiffness, and pain in the joints, typically affecting the lower limbs. Osteoarthritis. This is a disease in which the cartilage in the joints breaks down, causing pain, swelling, and stiffness. Psoriatic arthritis. This is a type of arthritis that can cause fatigue, pain, stiffness, and swelling in the joints. Rheumatoid arthritis. This is swelling, pain, and stiffness in the joints that typically occurs in flares and affects the hands, wrists, and feet. Bursitis. This occurs when there is inflammation in the bursa, which can cause pain and a reduction of mobility in the joints. Musculoskeletal disorders that can affect the bones include osteoporosis, a gradual weakening of the bones which typically develops slowly, making the bones more vulnerable to fractures and breaks; osteopenia, a decrease in bone mineral density that is not severe enough for a diagnosis of osteoporosis; osteomalacia, a softening and weakening of the bones due to them not hardening properly after forming. Several musculoskeletal disorders can affect the muscles and tendons, such as muscular dystrophy, which is a group of genetic conditions that slowly causes the muscles to weaken over time; sarcopenia, when muscles surrounding the skeleton start to lose size and strength; rotator cuff tear, a torn tendon around the shoulder joint that causes pain and reduction in mobility; tendinitis, this describes inflammation of a tendon. Repetitive strain on a tendon can cause pain, swelling, and a reduction of mobility in that area. Other conditions caused by musculoskeletal disorders include pain conditions such as fibromyalgia, autoimmune conditions such as lupus, in which the immune system mistakenly attacks the healthy tissues in the body; connective tissue disorders such as Marfan syndrome, which can cause abnormalities in the bones, eyes, heart, and blood vessels. Symptoms of musculoskeletal disorder can vary. According to Colorado State University, they include weakness, stiffness, numbness, a burning or tingling sensation, swelling, loss of strength, fatigue, and discomfort. According to the World Health Organization, the risk of developing musculoskeletal disorders increases as a person ages. Additionally, a 2022 research suggests that females may be more likely to develop musculoskeletal disorders than males. Causes and risk factors for developing a musculoskeletal disorder may include doing heavy physical labor, prolonged sitting or standing in an awkward position, repetitive strain, smoking, obesity, eating an unhealthy diet, not getting enough physical activity, having other health conditions such as kidney dysfunction, having a family history of musculoskeletal disorder, having metabolic syndromes, and having autoimmune diseases. Treatment for the musculoskeletal disorder may vary, depending on the symptoms a person experiences and the area of the body it affects. Several options may reduce pain, inflammation, and stiffness, and improve range of motion. These include low-impact exercises such as walking or swimming, physical therapy, pain-relieving medications, cold or heat therapy, medications to treat underlying conditions, or joint replacement surgery. As a CNA, you will be assisting many residents with musculoskeletal concerns. Falls are a major concern for any resident, but especially those with musculoskeletal disorders. CNAs can help prevent falls by answering call lights promptly, keeping walkways clear, and cleaning up any spills that may occur. Walkers or canes need to be kept in reach of residents unless care planned otherwise, and the residents should be wearing appropriate footwear. You should also encourage residents to move and perform self-care as much as they're able to during performance of ADLs. Read and follow the Cardex for each individual resident. Observing and reporting signs and symptoms of musculoskeletal issues is important as well. Any changes in the resident's ability to perform routine movements and activities, pain during movement, any new or increased swelling of the joints, white, shiny, red, or warm areas over a joint, bruising, and any other complaints of aches and pains need to be reported to the nurse. You have completed viewing this program. In order to receive credit, you must complete and submit the quiz associated with the program by following these instructions. Click the icon for the quiz on your desktop and it will bring you to the required quiz. Your in-service is not complete or accounted for until the quiz is completed. Enter your name and complete the quiz. You have now completed your mandatory education. If you have any questions, reach out to Sue Moran at 716-810-7004 or email smoran@beechwoodcare.org.